This video will provide a quick introduction to rehab philosophy for anyone new to the area of rehabilitation. There are lots of reasons to work in healthcare, and many of those reasons transcend work environment. When you ask people why they went into nursing or healthcare, you'll often get responses that include things like a desire to help people, to make a difference, and supporting people through difficult times. But each area has different goals and philosophy, as we all help people through their health journey. The founding principles of rehab nursing are ones that are applicable in all care areas. They include a point of view that all individuals have inherent worth and the right to become experts in their own health care, remembering that each individual is a unique, comprehensive, holistic being, and rehab professionals provide education and training to equip a person with skills and knowledge to maximize self-care. Let's take a look at the differences in primary focus of care provided in three common areas: acute care, long-term care, and rehab. Acute care is an area where there's a focus on survival. There's a tendency to provide care for patients in an acute crisis. The goal is to help patients through this crisis as they heal from surgery or acute illness. Once somebody is stable, they move out of this area. Long-term care focuses on health maintenance, provision of comfort, and quality of life in this venue. In this area, staff are working in the resident's home. Care is supportive and focused on maintenance and comfort more than improvement of health status. In rehab, the primary focus is on function, providing education and resources to provide people with the tools to return to a baseline or adapt to a new normal. The focus is on independence and strengthening. The priority is on quality of life on discharge. A person's time spent in rehab is often a time of adaptation and adjustment. There may be a focus on modification of environment, new tools, new baseline function, and change in self-image. This is a very active process. It can be a lot of work. And the relationship with their care providers at this time can be essential to setting the tone for life after discharge. Care providers in rehab focus on promoting self-care, maximizing independence, maintaining and restoring function, preventing complications, encouraging adaptation, quality of life, emphasizing abilities, and community reintegration. In rehab, nursing assessments and interventions encourage and support therapy plans. A big part of our work is to help carry forward patient learning and strengthening. Every ADL is therapy. For some nurses new to rehab, this can be a significant focus shift. I know the first time I had to observe a tiny, frail lady shimmy her way onto a bed that was too tall, I wanted so badly to run over there and assist her, but I couldn't. I had to observe how she was navigating her environment and determine whether or not modifications might be required. This was contrary to my helping paradigm at that point. The way that we help people in rehab is to focus on seeing how they do things on their own and distinguish between helping and hindering progress. Everything that a person does during their day is part of rehab. Rehab doesn't just happen during an OT or physio appointment, and every healthcare team member holds that philosophy. Here are some tips to remember. If a patient can walk, they should walk. If they can dress or bathe, they should do that themselves. Everything should be focused around how that person will manage at discharge. Rehab goals are also nursing goals, and interdisciplinary communication is essential. One thing that you will notice on a rehab unit is the use of the FIM scale. The Functional Independence Measure is a way of tracking functional progress. It measures 18 areas of function and is independent of diagnosis. It tracks the lowest incidence of functional ability during the 72 hours that function is being assessed. Each item is rated on a scale from 1 to 7, with 7 being full independence and 1 being complete dependence. If you're brand new to rehab, you won't be expected to start doing this assessment without training, but it's good to know that it's out there. There are other resources available about the philosophy of geriatrics. You will see that there's a lot of overlap in philosophy, and the two become one on a geriatric rehab unit. Some common philosophies between rehab and geriatrics are these. The goal may not be cure, it may be adaptation. Function is central. Patient care is not just about the presenting problem. Without holistic care, the rest can easily fall apart. Assessing prior knowledge is an essential part of care. An assessment of the whole person, their fears, strengths, supports, beliefs, and barriers is an essential part of the equation. Barriers must be dealt with. Support persons in a patient's life must be included in their care, and those support people should have resources located for them as well, if they need it. Each individual's situation can bring specific barriers to rehab, but there are a few that can be anticipated and you can watch for. These include sensory deficits. Make sure that people have their glasses and hearing aids. Making sure that pain is managed. Impaired cognition is common in older adults and can be a barrier to learning new things and remembering or learning exercises to do on their own. So integrating supports and tailoring strategies to this may be important. And if a person has Parkinson's disease, there are a few things to remember that are particularly impactful for rehab. Remember that not everyone with Parkinson's disease has a tremor. Non-motor symptoms such as fatigue, pain, depression, and constipation are often the most debilitating part of Parkinson's disease. If a person with Parkinson's has gait hesitation or freezing, remember to be patient. And it's essential to remember that people on medications for Parkinson's disease must receive their medications on time, every time, and according to the schedule that they had before admission to hospital. Altering schedule will affect function and can take a long time to regain control. Patients and families are the experts. Getting meds on time will shorten hospital stays, reduce the need for admission after discharge from hospital, and reduce burden on individuals, families, and hospital and care facility staff. This concludes our quick introduction to rehab philosophy, and I hope that you enjoy your new experience.